if you don't mind. I have a very busy day.
Well, ma'am, it's a hell of an apartment you got here. Hell of an apartment. I guess the books you wrote about these scumbags must have paid pretty well. Now, we can't afford to pay you your usual fee, but if you would be so kind as to look...
I don't want these here.
Would you be more comfortable looking at them downtown?
I don't want to see these here.
Well, I'll drive you if you prefer.
Andy.
Andy! Andy! Andy!
All right, it's okay. Breathe, I'm here. Breathe.
Should we call the paramedics?
No. Just a good old-fashioned panic attack. She hyperventilates till she passes out, then her breathing returns to normal, and she's fine.
What do we do?
She's agoraphobic.
She's afraid of spiders, too?
She hasn't been out of the house in over a year.
She's okay, though, right?
She's fine. Half an hour, she'll be singing like a lark.
Tell her we're sorry to have bothered her.
Recovery, Inc. International is a self-help mental health self-help organization that was founded by Abraham A. Lowe, MD. He was a neuropsychiatrist who figured it out, basically. This doctor, back in the 20s and 30s, figured out how to help people, suffering with the symptoms of obsessive compulsive disorder, the symptoms of post-traumatic stress disorder, anger management disorders. And he did it through a system called will training. And Dr. Carl Bell, will explain, once I play the video piece. But to make a long story short, it was because of the method and the techniques of Recovery International, Dr. Lowe's brainchild, that I was able to go from being terrified of flying to being able to board a plane and just calmly be able to just fly. And that was huge. That's how powerful the program was. How powerful the program can be depending on, who's in leadership, depending on, what area you're in. I know that it's pretty strong in Chicago. I hear that it's pretty strong in California, and it's also pretty strong in New York and other places as well. I learned so much from the people who they're now elderly, but, back during their youth, when, Recovery International was a lot younger than it is now, there were people who used to be agoraphobic, they couldn't leave their house, who, because of the method, because of studying Dr. Lowe's materials and attending the meetings and practicing the technique, they went from not being able to leave their house to being able to leave their house. They went from, suffering from severe panic attacks to being able to not be afraid of the symptoms anymore. Okay, this is an organization where I served as a group leader for 2 years, and it really is an amazing system. It is an amazing program that helps you to deal with your, anger management issues, your fear issues, through cognitive behavioral methods that Dr. Lowe, again, figured out back in the 20s and 30s. And then, people were getting well. They were getting well from their mental illnesses. They were getting well from their emotional disorders. They were getting well from their, obsessions and, the whole OCD thing. And so many people were getting well. And, like I said already, they tried to yank his license over that. Now, I did hit a place in my life where I needed to focus on the spiritual when I was recovering from, the religious abuse that I experienced. When those issues came up, you know, and that's what tends to happen. You're a child, abuses happen, you're a teenager, abuses happen, and then it surfaces in your adult life, you know, around midlife or something, and then, you know, you have to face all of that stuff that is, you know, pushed up out of your, you know, subconscious or your unconscious mind, and, you know, it's there for you to deal with. And that's what happened to me. So I've had more of a spiritual, not religious, but spiritual focus as far as, you know, recovering from the post-traumatic stress disorder and, you know, from the panic attacks that come with that, and the anger issues that also, you know, come with it. And it all boils down to, you know, whether you have OCD, whether you have, you know, post-traumatic stress disorder, whether you have panic attacks or panic disorder, it all boils down to, you know, and other mental health challenges, it all boils down to the whole cognitive behavioral thing where, you know, whether you're on medication or not, they're teaching you how to not react to your symptoms, to not overreact to your symptoms, to not be just taken for a ride, you know, to not be, you know, drowned in your symptoms, you know, because it feels like an ocean wave, you know, whether it's OCD, it's all anxiety. All of it is, you know, nervous symptoms. It's all nerves, basically. The symptoms are, you know, a person with OCD, you know, they go and they don't, you know, do the hand washing thing, the hand washing ritual. If they refrain from it, you know, they get thoughts of danger, the thoughts, you know, telling them that they're in danger and they have to do this thing in order to feel safe. Someone, you know, with panic attacks, they have to get to the emergency room because they feel like, you know, they're dying. They feel that something, you know, terrible is going to happen to them. And they have to get to that emergency room or get to that safe person in order to feel safe. But where these things are connected, even though they're different diagnoses, the whole point of it is to get to a place, the whole point of therapy is to get to a place where you learn to be exposed to the things that you're afraid of and you learn to underreact. And that is what Dr. Lowe taught his patients to do. Now, about Dr. Carl Bell, you know, he came across Dr. Lowe's books and studied him, and he's like, this is the answer. You know, he's also using this program to help inner city kids to cope with their anger issues, you know, with gang violence. But I'm going to go ahead and let the video play, and I'm going to also upload, you know, more on Dr. Carl Bell and Recovery International, formerly Recovery Inc. And Dr. Lowe always said that, you know, even though you may be feeling helpless, you know, basically feeling overwhelmed, like there's no hope, you know, for what you're suffering through, that even if you're feeling hopeless, even if you're feeling helpless, if you're feeling helpless, that you're never hopeless, because when you get the right information, when you get the right support system, you know, and when you get the right therapy, those things together, then that means that there's hope. Let me know your thoughts, let me know if it was helpful, and with that, I'm going to go ahead and close the video, and I will see you next time. Take care.
Every day, Americans look for alternative methods to improve their health and wellness. Here's a fresh approach to rejuvenating your mind, body, and spirit.
According to the National Institute of Mental Health, an estimated 57 million Americans ages 18 and older suffer from a diagnosable mental disorder in a given year. However, fewer than 8 million seek treatment. Today, Celinda, Mike, and Maida are participating in a Recovery International self-help meeting, offering assistance to people suffering from emotional problems such as depression, anxiety, panic attacks, bipolar disorder, fears and phobias, and chronic stress. As they continue to gain from practicing the RI method, they also give back by leading group meetings.
Our friend Frank Rochford recounted a simple
mental health self-help programs like Recovery International assist people with mental and emotional problems to lead more peaceful and productive lives.
The foundation of Recovery International is a training system that helps us learn to manage the symptoms of our illness. It's based on the groundbreaking work of the late neuropsychiatrist Abraham Lowe. In 1937, when Recovery was founded, there was no self-help for mental health. Dr. Lowe pioneered the idea that people could apply common sense, practical techniques to learn to manage their symptoms.
Fear of disclosure, rejection by friends, and discrimination are among the reasons why people with mental illnesses avoid seeking help and tend to stay silent. But programs like Recovery International help people identify and manage negative thoughts, reactions, beliefs, and behaviors that lead to emotional pain and disturbing physical complaints.
Recovery International is a tried and true method of training the frontal lobes, which are the computer brain part of the body that actually controls those animal systems, those fear centers, those depression centers, those excitement centers that are all subcortical. It's probably a 71-year-old original cognitive behavior therapy, which helps people get perspective, gain control, and not believe what they think.
What she had accomplished was to demonstrate the fundamental principle of recovery, that symptoms can be conquered by means of simple and innocent procedures.
I was suffering from chronic panic disorder and depression, and I was getting to the point where I couldn't imagine going on any longer. And I found out about recovery. I realized at the first meeting that there was hope. I was thinking I've got to find a way out because I've tried so much and nothing worked, and recovery has.
I was diagnosed in 1995 with severe depression and anxiety disorder. And 21 years ago, when I was discharged from the Marine Corps, I started seeing how it was negatively affecting my life. And it had a tremendous effect on my relationships with the women I was dating, with family, friends, and everybody. And you know, recovery has helped me with being able to deal with my inner environment, being able to see things as a triviality rather than expressing them all with this sense of emergency and attaching all kinds of danger to it.
With over 600 groups across the nation and abroad, including telephone groups, RI's practical coping techniques have helped tens of thousands of people around the world.
Self-help groups like Recovery International are critical for professionals because you can't do everything in a psychiatrist's office in an hour. You got to do some homework. And so self-help groups consist of helping you practice that homework with people who've been there and done that.
Recovery has had a wonderful impact on my life. It's been tremendously positive, and I've been able to get things in control, and I've been able to get back into the field that I work in, which is telecommunications, and I'm working on leading a meeting in the San Gabriel Valley where I live.
If you would like to learn more about this story, please visit recovery-inc.org.